Hey guys! In our quick learning series, today's topic is medical ventilator, also called artificial respiratory system. A mechanical ventilator is a machine that helps a patient ventilate, when they are having surgery or cannot breathe on their own due to a critical illness. The patient is connected to the ventilator with a hollow tube, artificial airway, that goes in their mouth and down into their main airway or trachea. There are several types of pulmonary ventilators. The first one is urgency ventilator. An urgency ventilator must be small, reliable, robust, and simple to use. The second one is an anesthesia ventilator. An anesthesia ventilator is composed of a mixing and dosing gas unity, air, oxygen, nitrogen oxide, N2O. The third one is the resuscitation ventilator. A resuscitation ventilator is characterized by its long use, several days to the same patient. And the fourth one is pediatric ventilator. A pediatric ventilator works with the same principle as a resuscitation ventilator. The only difference is that the patient circuit is performed with a small diameter pipe. Small volume issued and high frequency. Also, there are different ventilation modes available. In checked pressure mode, the ventilator works with preset pressure, duration, and frequency with a decreased output. The objective of this mode to allow a constant level of pressure during the inspiration, avoid a high level of pressure within the respiratory system, allow a decreased output, and enable a checked frequency. Application of this mode for the patient who suffers an injury at the level of the tracheal tube, or lungs, or suffering from asthma. In checked volume mode, the ventilator works with preset volume, output, and frequency. The objective of this mode is to allow checked volume ventilation, supply with preset volume and frequency, and supply with a checked insulation duration. The application of this mode is to support patients with normal lungs or the patient at post-operative care. In assisted volume mode, the patient raises each breath. The ventilator adjusts automatically the level of assistance by adjusting the volume of issued gas. The objective of this mode is to supply with ventilation where each respiration is raised by the patient, allow assisted ventilation in case of apnea, and supply with variable assistance regarding the need of the patient in each respiration. The application of this mode is to provide support to patients with an insufficient capacity to breathe. In many cases, mandatory ventilation mode is first necessary to treat the patient with mandatory ventilation, and as the patient's condition improves, spontaneous ventilation can be introduced. Spontaneous ventilation is an important phase in providing respiratory therapy to a recovering pulmonary patient, is weaning the patient from the respirator. As the patient recovers and gains the ability to breathe independently, the ventilator must allow the patient to initiate a breath and control the breath rate, flow rate, and the tidal volume. Thanks for watching and see you in another video with a new topic.